A common question I get when someone is referred in for a shoulder replacement is, well, what's this reverse shoulder that I'm hearing about? And in shoulder arthroplasty or shoulder replacement, we commonly discuss what's called an anatomic shoulder replacement, which is replacing the worn out socket with a plastic socket component that's shaped like a socket, and replacing the humeral head or ball part of the shoulder with a metallic kind of ball part. So an anatomic shoulder replacement, we're really trying to replicate as closely as we can somebody's native kind of pre-arthritic anatomy, trying to restore the optimal kind of shoulder function and get pain relief. In a number of cases though, particularly if there's very complicated bone loss patterns because of the arthritis, or for example, there's accompanying rotator cuff pathology or a irreparable rotator cuff tear, that's when we often use what's called a reverse shoulder replacement, or in some revision settings, et cetera. In the reverse replacement, we actually put a ball-shaped component or glenosphere on the socket side of the shoulder and turn the ball part of the shoulder into a socket with a stem going down the humerus. And what that does is changes the anatomy of the shoulder just enough to allow for other muscle groups to compensate for a rotator cuff that's not functioning. Because an anatomic shoulder replacement is a great operation, but it relies on a functional or intact rotator cuff for its mechanics. And so if the rotator cuff isn't there to support it, then a reverse shoulder replacement is a better option. If you have any questions about which one's best for you, then come in and see us. We'd be happy to talk through it.